I was offered a job as a community organizer in La Junta in southeastern Colorado at the end of '72, and I jumped at the opportunity. And so one of the first things I did was help to start a co-op, a food co-op. And that was important because it gave some credibility to me and to others that were working on the project in regards to the community and what it was we were trying to do. The next big project that came up that needed to be addressed was that of health services and health care. Now, one needs to understand that this is a really different time in our country's history. This was before a federal law called EMTALA, the Emergency Medical Treatment and Labor Act, which was passed in the mid-'80s. So this is a dozen years before. So in our country, you could still legally be turned away and refuse health services at a hospital if you didn't have money. If you went to the hospital and wanted to get services, you could be refused services if you did not have money, yes. Now that's incredible for most people to appreciate today. It's very hard to understand what that means. But that's what existed in those days, and that's what we faced in those days. When one thinks about the community health center movement in the state of Colorado, you've got to go back a long ways. Keep in mind that Denver Health was the number 2 health center in the country. It started in '65. The Salud Family Health Centers, where I've spent many years, was started in 1970. Clinica Campesina and Valleywide were started in '72. And in 1973, I was living in Rocky Ford, and it was there that as a community organizer, I realized that what we needed was to come up with a different system of health care for the Chicano the community, because we were being excluded from the system of care that existed at that time.
We had to deal with the politics. It was like David and Goliath almost, if not worse at times. No one, I don't think in the community, even people who were lifelong members, thought we would get anywhere with providing health care for those that had historically been underserved. The frustrating part was trying to make that dream, make that vision come true. There was a lot of stumbling blocks, a lot of trial and error. You have to imagine I was 20, 21. Virgil Licona was, 24, 23. And he was an outsider, according to a lot of people. And he wasn't only an outsider, he was a rebel rouser. He was a radical. And no, you don't want to bring those kinds of people here and their ideas and their vision. What kind of vision? So you had to have a commitment to what you were doing in spite of everyone. And that's how the clinic community health center started. And later it even became even more political when the name was changed from Community Health Center to La Clínica del Valle.
Well, at the beginning, it was a real downer, negative ideas about it. They didn't think it was gonna amount to anything. They didn't think it was gonna amount to anything. Me as a board member, now I look back at it and I'm just thrilled that I was a part of something big that happened. It was just a little thought of somebody's thought, and here it is. It's over the Tri-County, and they're writing good articles about him. It's just amazing. And it's the people that started it.
There were a lot of people involved in getting this started, not 1, 2, or 3, but a lot of folks from the community that would later form part of the community board, and individuals that were interested in doing the right thing. I was one of those folks. And I was the one that did not take a step back. The community asked me to be the first director of the clinic. Now, this is before we had a clinic, okay, but to take that idea and to run with it. And a grant was put together. A young lady named Jennifer was critically important in starting the clinic in Rocky Ford because she was the grant writer. She put together the grant application that went to the Catholic Church and their program called the Campaign for Human Development. And we received a grant of $50,000 for them in the spring of 1973. And it was with that promise of dollars that we started the clinic in Rocky Ford, just like the Salud Family Health Centers was started on a nickel and a dime and selling tamales and cookies and whatever it was we could do to earn money. That's what we did in Rocky Ford. That's what was done in Alamosa. That's what was done throughout the state to get the community health center movement going. How did we do it? Well, we had a big stroke of luck that got it going. I was able to get a doctor from National Jewish to come down for 6 weeks to work for us for almost nothing. I think it was nothing. And so David Hudgel came down and worked that summer for us. That allowed us to get started. The Catholic Church leased us a 3-bedroom, 2-story house in Rocky Ford for $1 a year. That became our clinic for the next 30 years. I thought it was the ideal situation, and for a young Chicano organizer, it was. You go back to the community loves you. It's lots of work. It's not very much pay, but did I tell you the community loves you and you get stroked all the time? So those were the things that we were offering, but young doctors were not all that interested in those things then. There were some still burning on fumes from the 60s, though, wanting to change things. And Tom Flower, the first doc that I recruited long-term there, was one of those, I think. So he came, and once he got there, I knew that I had to go back to school and I had to become a clinician. Now, that's easy to say. Keep in mind, I thought I was going to be teaching Chicano history at this point in my life, so I did not study science. I didn't like science. I could do math. I was good at math, but it wasn't stuff that I had studied. I was a soft social scientist, enveloped in history and the medieval period and, southwestern history of this country, Mexican history, those things. But I did so not because I wanted to be a doctor, not because I had this great idea of healing people and saving lives. I did it because the movement needed another clinician. And although it may be difficult for someone to understand me today when I say that, I sit before you in all honesty and say, that is what motivated me. That is what turned me on. That is what got me to do everything that I've done since. The very fact that I, as a product of the Chicano movement, needed to go back to school to learn a new skill set because the movement needed me to do so, seemed by that time in my life only logical.